And so the cuddling really helps to help them to console them, to make it more manageable for them to grow, sleep, um, manage their care a little bit better without any type of medication to help manage these symptoms. And also sometimes certain babies with GI issues, they have also helped because some babies need to be kept up for a little bit to help manage those issues. These colors help to support that, as well as that physical touch. That's very important. Sometimes people minimize the impact of having consistent physical touch on the babies due towards their development, into good, happy people.
So, NYU Langone in Long Island instituted their long-awaited NICU Cuddler program in 2023 after the pandemic shut down plans for its beginning in 2019. Since then, many infants who are premature or suffering from other health conditions receive care and comfort from volunteers called cuddlers. The cuddlers sing to them, rock them, speak comfortingly to them, and help to ensure that these babies receive the extra care they need only when their own parents can't be there due to work or other obligations. Premature infants are usually kept in the NICU while the mother is released to return home, and all newborns, but especially premature or ill newborns, need extra care. These cuddlers can help make nurses' jobs easier by caring for the babies one-on-one while the nurses attend to the needs of their many patients. So we're here today with 3 members of the staff at NYU Langone. So the first,
Long
LaShawn,
Island. Be very specific. Long Island.
Long Island, right. So LaShawn Pitter is nurse manager and neonatal ICU, is at NYU Langone Hospital, Long Island, and has a master's in nursing, business, and healthcare management. She's certified in neonatal intensive care and also a board-certified advanced nurse executive. Jean Zabrowski Clifford, Director of Volunteer Services, who has been with NYU Langone since 2018 and with NYU since 2000. She's also a certified director of volunteer services, CDVS. She is pursuing her master's in healthcare administration from NYU Robert F. Wagner Graduate School of Public Service. And the last person who will be joining us in a few minutes is Letitia Rios, nurse educator, learning and development specialist at NYU Langone Health in Long Island. She is involved in a research project titled Increasing the Success of Exclusive Breastfeeding Rates and Duration, and she is a certified neonatal intensive care nurse. Welcome to all of you, and thank you for being with us today.
So Leticia has joined us.
Oh, hi Letitia, how are you?
How are you doing? I'm fine.
Okay. So, and I'm just going to ask the questions, and anybody who feels that they would be most appropriate to answer can go ahead and answer. So the first question that I have is, what does a NICU cuddler do?
So thank you again for having us. So the NICU Cuddler volunteer will cuddle a baby. They will comfort the baby. They will spend that one-on-one time with the baby in absence of any family there. They will also hold the baby upright after the baby feeds because some have reflux, and it's so much better to have the baby held by someone rather than in their isolette with their mattress on an angle. And we actually have had cuddlers that have changed their schedule around primarily to be on shift after the baby feeds. We also, for those babies that are not able to be cuddled, we have our cuddlers who read to the baby. So we've had great donations from the community of brand new children's books. So we're able to read to the baby and then give that book over to the parents. And then we do have some volunteers that play music for the baby.
Oh, that is so awesome. So How long has the program been in place? Was it just started in 2023? Was this like picking up something else, or?
We actually celebrated a year October 1st.
Hmm.
We had plans on rolling it out right before COVID. So we were very, very pleased that those cuddler volunteers that were ready to begin actually stayed with us the entire time during COVID. They said, you know, we've signed up for it, we're trained, we're sticking with you. And I can't even tell you how many screams and cries that we heard when we sent that email out to the cuddlers saying, come on, we're ready to roll out the program. So we've been, again, over a year, and we've cuddled over 500 babies.
That's so awesome. So, what are, I guess there's probably a lot, but what are some of the benefits to the babies of this program?
So there are a lot of benefits for the babies. We have a lot of babies with different conditions, including neonatal abstinence syndrome when they're having withdrawal. Sometimes when the moms take certain types of medications, then these drugs have a effect on the baby, make them very irritable, and so the cuddling really help them to console them, to make it more manageable for them to grow, sleep, um, manage their care a little bit better without any type of medication to help manage these symptoms. And also, sometimes certain babies with GI issues, they have also helped because some babies need to be kept up for a little bit to help manage those issues. These colors help to support that, as well as that physical touch. That's very important. Sometimes people minimize the impact of having consistent physical touch on the babies due towards their development, into good, happy people. And so it's good to have their support because they not only just hold, they do talk to them, very soft tones, play music. So that helps with the sensory development. They don't develop detachment syndromes and aren't able to have good connections for the future. So we're very happy that we helped to establish that early on in their development. Anything you want to add?
So, I guess when the babies who have the neonatal abstinence condition, they're not like, whereas a grown up would potentially be given like drugs to mitigate that. Obviously, with a newborn, you can't really do that. So this is something that you guys, that they're able to help them to kind of go through that. I guess it would be like withdrawal symptoms and stuff like that.
Yeah, with the babies, you can give drugs to mitigate it depending on how they score. So we use scoring tools to assess whether or not infants or neonates need medication to help to manage the symptoms. But even with that, they still would benefit from consoling even on medication. So it still helps. And some parents are not able to be present 24 hours, 7 days a week in the NICU. And we do have some patients that have a long stay here, to be up to 3 to 4 months. And the cuddlers help to provide that positive touch where, the nursing role and is becoming more complex and more challenging. So the cuddlers offer some support in areas where nurses might have to do more clinical things, and they are able to sit, hold, and cuddle this patient, and also read to them, sing to them, and support of the team. So they're really a part of our team.
Oh, that's awesome. And what are some of the benefits to the parents of the babies that are in the hospital of this program?
The parents feel a sense of relief because sometimes they're very guilty that they're not able to provide that time to be, especially when the baby's been here a little bit longer than they expect and they have to return to work to conserve some of the time to be able to be with the baby after discharge. And so that means a large part of their day they're not here. And so they're worried that, the baby will be in the bassinet or the isolette for long periods of time, not being touched or consoled. Although the nurses, do care for the babies, but sometimes we have more than one, so the parents really want them to get that constant touch. So despite having visitors, some parents don't have a lot of visitors to be able to help support. So knowing that someone is at least coming in a couple hours a day to provide that additional support and that I want to say
Medical.
Yeah, non-medical touch time, that really helps because it's more positive touch than, negative for us having to do certain treatments and different things.
Right, like these are not the people who are going to be sticking the needle in their ankle or
Right. Yes.
something like that, and they know that that's a different person.
Yes.
It also is. It also helps the parents who have twins, and one twin may be home, the other twin is in the NICU. The moms are torn. That when they're home, they want to be with the baby in the NICU. When they're in the NICU, they want to be home with their other baby. So it does give, as LaShawn said, it gives that family a sense of relief. We've seen it many times with twins.
Oh, awesome. So, what are some of the health conditions that the babies in your program do have? I know you mentioned neonatal abstinence syndrome and prematurity. Is it mostly that, or are there other health conditions as well?
So reflux, like LaShawn mentioned, is another one where patients have, neonatal patients or premature patients have a sphincter reflex that's a little bit like delayed or not as strong, so they are more prone to spit up. So we do use the cuddlers in a way to support holding them up after feedings. Like if a nurse has maybe 3 patients to feed at, this time, she might feed the patient with the reflux first and have, say, hey, the cuddler is present. She can hold the patient up while I go and set up for the next feeding. So when we developed the program, we did develop the program including a criteria of patients greater than 34 weeks and included patients with neonatal abstinence syndrome, now known as neonatal opioid withdrawal syndrome, and also the patients with the reflux as a starting point. And hopefully we can advance, to smaller patients in the future.
Awesome. So is your program full, and is there a waiting list to join?
Yes and yes. And actually we're no longer accepting applications only because of the extensive waiting list.
Okay.
So we have so many dedicated volunteers. So
about how many people do the cuddling, and how long was the waiting list before you guys stopped it?
We have 10 active cuddlers, and so right now we have probably, I'd say 50 or 60 on the waiting list.
Okay. So I know you kind of mentioned that the cuddlers are trained. So how are they trained, and how are they vetted?
So the first cuddlers, for the majority of them, they're retired clinicians and educators. They are interviewed by our department. They're also screened, and they're sent a background check. And then they're introduced to LaShawn and Leticia. We do orientation, general orientation with them, which is an overview of the hospital, fire safety, HIPAA, confidentiality, patient experience. And what we did was we brought the cuddlers together in person for that general orientation. We had representatives from infection prevention review hand washing techniques with them, and we had representatives from our patient experience department, and then we turned them over to Leticia as the nurse educator, and she can go through the remaining training.
So we also cover hand washing, even though that's covered by IPC, because we definitely take infection prevention very seriously in the NICU. Neonates are the most fragile and vulnerable population. So we have a lot of efforts and interventions and training related to infection prevention. But the cuddlers also receive the training that they receive include the benefits of cuddling, neurodevelopmentally, and then also, like LaShawn mentioned before, having some positive touch or touch that's not associated with an intervention. So most of the time when the providers or the nurses go in to touch the patients is also always associated with something maybe not positive, maybe negative, a heel stick, or just different things. So this is actually not just having them have the association with touch being with a negative. So that's part of it. We also go through the do's and don'ts as far as HIPAA, exchanging phone numbers with the parents, disclosing any personal information about the patient, asking any questions that may be personal about the patient. We talk about that. We also discuss how to hold the patient. We also discuss any signs that they may see that may be worrisome and how to escalate that to a nurse, even though they are supervised the whole time by a nurse when they're in the cuddling a patient. We go over how to introduce themselves, that they should be, always wearing their badge, and how to identify themselves in this area. So we go through a lot of just the NICU environment, what signs and symptoms to look out for when they're holding the patient, and how to interact with the staff and the parents.
Awesome. So is this particular program at your hospital 24 hours a day, or are there certain hours it's in practice?
Our latest cuddler shift ends around 11 o'clock at night. But going forward, we may do night shift as well. But it is 7 days a week.
Oh, that's awesome. Because there's one of these programs in another state. I don't remember. It's somewhere in the Midwest. I was watching a video where they do it 24 hours a day, and they have somebody come in till 4 in the morning. Which I know the nurses are there at 4 in the morning. The nurses are still there with their overnight shift.
Yeah, but they would still love it.
Yes, one nurse asked me yesterday when we were doing a mandatory training. She said, "Where are the night cuddlers?" I said, "We're working on that."
And then,
we have to get some night owls.
Yes. So prior to instituting it at your hospital, how did you learn about cuddler programs?
I attended a volunteer conference quite a few years ago, and the guest speaker was a volunteer director who had worked with their hospital staff and developed a cuddler program. And they were talking about the benefits of it. So that's where the idea for our hospital came from. And then we were actually approached by the staff. Two of our nurses were retiring, and they wanted to return as cuddlers. So that's how the idea spurred.
Yes.
Oh, that is so cool. And I guess what made you decide you wanted one at your hospital was kind of like these two nurses who did it, and you found out about it. It was like, this is a really awesome program, and you thought that it might be helpful to your patients.
And then we saw the research. There's research studies that show the benefits of cuddling, and nursing is just such a great partner to work with, and I love working with LaShawn and Leticia, and they embraced it too, because it's for a nurse to trust a layperson with their baby is a big undertaking. And it was an issue of trust also. So nursing trusted that volunteer services would vet these volunteers, and that these volunteers were able to be trained and trusted to take on that responsibility of holding that baby. And then they actually also committed to the training, which was a big undertaking also, because it was a classroom training, and then it was hands-on training as well. So it's 2-day training, just from nursing perspective.
And what has been the response of patients to the program? And by patients, I mean both the parents of the babies and other patients in the hospital. who find out about it or who know about it?
We've had a great response for the most part. We did have a parent who actually had she had her first baby in the NICU when the program wasn't around, and then her second baby was involved, and she was very grateful for the experience and wished her, we had implemented it back then for support because she does have other children at home. So this was great that she was able to feel comfortable that, she knew her baby was getting this extra loving support from home. We did have some parents, to be honest, that some were skeptical, right? That or felt guilty that a quote unquote stranger was holding their babies. But we really had to provide that supportive education that this is a opportunity to help not continue your guilt, right? That because they felt like, well, I'm going to be here, and then now you're exhausting yourself having to come all the time. It's definitely their mental wellness and their ability to care for themselves is important, and that can impact the baby's care. So we tell them we don't need you to feel guilty and feel like you have to be in here all the time, and that's why we have this extra support to do it. We've talked about maybe even changing the names because some people were weirded out about cuddler, right? And so that's something that we might, for the future, decide on to make something a little bit more, I guess, softer, right? Not scarier for that.
We also had the baby was being cuddled by a volunteer, and the mom came in, and the cuddler said, "Oh, I'll get the nurse." So because we're not able to put the baby in the bassinet or give the baby to anyone but the nurse, so the cuddler said, "Oh, I'll get the nurse for you, and the nurse will give you your baby." And the mother said, "You know what? She's very happy with you. I'm going to come back. I have some things to do. She's very happy. She's sleeping in your arms. I'm going to come back." And the mother actually left and then came back a few hours later. And then we have had some parents talk to other parents about the program saying, oh, you know what? You should learn about these cuddlers. They're really great, and you should sign your baby up for it.
Right.
And you know what, ladies? I have to hop off. It's 10:30. I'll see you ladies in Nashville. Thank you so much. And any other questions you have, I'm sure Letitia and LaShawn can fill in my part.
Yes, absolutely. It was great meeting you. Thank you
Safe
so
travels,
much.
Jean.
Thanks.
See you soon.
Okay, so, and I think I already asked how many cuddlers are in your program. So there's like 10 cuddlers in your NICU. But they're not there all the time, so they're in shifts, right? So there'll be like 4 or 5 people per shift or something like that, or is it?
So sometimes there's like 1 to 2 per shift. There are 2 cuddlers that like to tag team, so they come together. But for the most part, it's usually about 1 who's on that circulates in the unit.
Okay, cool. And what is the feedback from the cuddlers themselves about the program?
They find it so rewarding, especially when they see an irritable baby that isn't, able to console and who hasn't been enrolled. They're ready to just pick up the baby, but, to just provide that support. But it's not possible until the parents sign that consent. But they love it. They talk about how rewarding it is that they're not just staying at home and, doing nothing, that they're able to help in this capacity. And they really wish there was more babies that are available for them to cuddle. But just being able to play music or read to the babies or to give a soothing touch, a soothing touch or a soothing voice, especially when they see that the staff is, occupied by something else, then, they just find it so amazing to be a part of the team and help in that capacity.
That is awesome. So how do the staff members, such as the other nurses or other staff members in the hospital, I guess doctors and physicians as well, how do they feel about the program?
They love it too. They're thankful because it really, I'll be in my office and hearing babies cry and want to get out the meeting to go, bring the baby in, or, to console the baby. So it's really helpful, and they really see the impact, how calm we may not have as much episodes of spit up because that they're constantly able, to be held up, those things, and how that has helped to support the baby's pain management. We may not have to use as much medication for, those babies who have the neonatal abstinence syndrome, in order to, provide that support. So they love it. If we can do it all the time, they definitely would be on board with it.
Yeah, and parents don't like when they come in and their baby's crying, and,
Mm-hmm.
and the nurse that's taking care of their baby, or is assigned to their baby, is like maybe might be have her hands in with another baby patient who might have just had a deep, a critical episode occur. So having the cuddlers here has also reduced the anxiety around, is my baby, getting the individualized care that they should be getting. I can't be here all the time. I would love, for my baby to be cuddled or be attended to every time that they cry, because that is what will be happening at home. So the cuddlers really help to support that as well.
That's awesome. And is this program only in the NICU?
So we are actually working on extending the program into our pediatric area. We did have a baby who actually transitioned to our PICU, and they followed the baby up there to continue to provide support. And then while they were up there, they identified a toddler that was there whose parents could not come. And so the cuddlers are actually requested if that toddler could be enrolled in the program. And so Jean agreed. We reached out to the mom, and she was very grateful to have her toddler enrolled. And so you could see the difference. The staff talks about how the toddler reacted. I mean, the toddler was great, wasn't quiet and fussy, but just the interaction, how she lit up when the cuddlers came in the room to provide that individual support was amazing. So that's our next steps to, expanding it outside of the NICU for those kids who don't have parents who can be there all the time.
Well, that's awesome. And how did COVID affect this program and the NICU?
Negative. We couldn't have the cuddlers, unfortunately, come. We had to limit the amount of visitors, even with families. We had to limit it to just the parents coming. And so we could not provide that support for them. So it was very hard because we had done a lot of background legwork. We was ready to get it rolling, and then, boom, we had to stop. We couldn't move forward with it. And so a lot of the cuddlers who were on waiting lists and, anxious to get in, couldn't get in. And so I think we did see a decrease in people signed up in other hospitals that had the program, but we were very anxious for them to come, but safety first, right? Not only the babies, but the parents and the staff. So, and for themselves too, because they are older adults. So, and who, and they're more susceptible. So we definitely told them that, it's better for you, not to come, because, it was just overwhelming with with the pandemic and everything that was happening.
Right. And that's all the questions that I have. So do you guys have anything that you wanted to add?
Anything to add?
I think we covered most of it. We're just really happy to have this program.
Mm-hmm.
We've gotten a lot of very positive feedback.
Mm-hmm.
Initially, like Jean said, the nurses were a little bit reluctant to, have other people involved in caring for, the patients, because they get very connected to their care and very I want to make sure that I'm overseeing everything. But now they're like, where are the cuddlers? We need more cuddlers. I want the cuddlers. Everybody is so happy that we have the support of the cuddlers, because we wish that we had octopus arms, or we could, take care of and have all the babies at one time, but we can't. So having this support has been a tremendously, amazing experience for us.
Mm-hmm.
Oh, that's awesome. Well,
Yeah.
yeah, it was really great meeting with you guys, and I was really, it was really great to learn about this program. I didn't actually know that you guys had it. When I heard about it, I knew New York Presbyterian had it, and then I looked it up on Google, and I was like, oh, there's 5 hospitals that have it, and you
Yes.
guys were one of them. I was like, that was great, because
Mhm.
I was so excited to speak with you guys,
Mhm.
because it's, you know, it's all focused in New York City too, except for a few that
Yes.
are in the Midwest.
Mhm.
But all of those are in New York City, so it gives people that extra option of of a better choice. So like if somebody decides I want a hospital with a NICU Cuddler program because I just heard about this awesome program, there's only a few choices then that they would have, in terms of where the Cuddler programs are. So hopefully there will be more in the future, and all the other
Yes,
hospitals will follow
definitely.
suit as the
Yeah.
evidence
Mhm.
continues to pile up for the benefits
Mhm.
of this program to the patients and stuff. So yeah, it was really great meeting with you guys, and
Same to you. Thank you for the opportunity.
Thank
thank you
you.
so
Mhm.
much.
Thank you, ladies. Have a wonderful day.
Thank
You
you so
too.
much.
Take care.
Bye.
Bye.
Bye bye.